Did you know that your body might be trying to tell you something about your health while you sleep? Diabetes, one of the most common diseases worldwide, often goes unnoticed for a long time, until serious problems show up. What if there was a way to spot the signs early on? Today, we're going to talk about 10 nighttime signs of diabetes that you shouldn't ignore. Stick around until the end because we're not only going to show you how to recognize these signs, but we're also going to give you one essential tip that could improve your quality of life. Let's get started. Night sweats. This sign can be more than just a nuisance. Waking up sweaty might seem like it's just because of the heat, stress, or a heavy blanket, but it could also be a sign of something more serious, low blood sugar at night. When your blood sugar levels drop too low during the night, your body tries to fix it. It releases adrenaline and other hormones to stabilize your blood sugar, which can make you sweat a lot. This doesn't just mess with your sleep. It could also mean that your metabolism isn't working properly. Night sweats can be so bad that you have to change your clothes or even get up in the middle of the night to take a shower. Plus, the poor sleep that comes with night sweats can affect your energy levels and how well you can control your blood sugar during the day. There are a few reasons why this might be happening, like changes in your diet, the wrong medication, or an unbalanced lifestyle. If this happens to you a lot, it's important to talk to a doctor. A blood test can tell if your blood sugar levels are dropping too low at night. There are solutions out there, from adjusting what you eat for dinner to changing your medication, that can help stabilize your metabolism and improve your quality of life. Don't ignore these signs. Your body might be trying to tell you something. In second place, we have frequent urination. That sleeplessness you're experiencing could have an explanation. Getting up multiple times during the night to use the bathroom might seem like a small annoyance, but when it becomes a habit, it can point to a more serious issue. This symptom, known as polyuria, is common in people with diabetes and is directly related to high blood sugar. When glucose levels in your blood exceed your kidney's filtration capacity, they work overtime to eliminate the excess sugar, which leads to the release of extra fluids through urine. This cycle not only disrupts sleep, but can also lead to severe dehydration and fatigue. Many people don't associate this symptom with diabetes and attribute it to drinking fluids before bed. However, if nighttime urination persists despite not drinking much before going to bed, it's time to pay attention. A simple blood test can determine if your blood sugar levels are outside the normal range. Recognizing this symptom early allows for intervention to avoid more serious complications like kidney damage or metabolic imbalances. Consulting a doctor and making lifestyle changes can be crucial to restoring your sleep and protecting your health. Third, excessive thirst at night. A thirst that you just can't seem to quench. Do you ever find yourself waking up in the middle of the night with an unquenchable thirst? This is called polydipsia, and it often goes hand in hand with needing to use the bathroom frequently at night. When your body gets rid of large amounts of glucose through your urine, you also lose fluids, causing a constant feeling of thirst. But this thirst isn't easily quenched, and it can really mess with your sleep. Nighttime thirst can be much more than just an annoying symptom. It can actually be a sign that something's off with your metabolism. Many people blame this on things like the weather or eating salty foods, but if it happens often, it could be a sign of a more serious problem like diabetes. Drinking lots of water at night can actually create a cycle of dehydration and urination, which really impacts your quality of life. If you're experiencing this, it's important to talk to a doctor. Early diagnosis can identify any underlying issues and help you manage your blood sugar levels. With the right treatment, that nighttime thirst can disappear, allowing you to get a good night's sleep and improve your overall well-being. In fourth place, dry mouth. More than just an annoyance. Waking up with a dry, sticky mouth can be more than just a small problem. This condition, known as xerostomia, is linked to dehydration and high blood sugar. When your body loses fluids because of frequent urination, your salivary glands don't make enough saliva. This causes a dry mouth, especially at night. Besides being uncomfortable, dry mouth can seriously impact your oral health. Saliva is really important for preventing infections, protecting tooth enamel, and keeping gums healthy. Without it, you're more likely to get cavities, gum disease, and other dental problems. Even simple things like chewing, swallowing, or talking can become difficult. If you keep having this symptom, it's important to see a doctor. A specialist can figure out if it's related to diabetes or other medical conditions. Getting treatment early will not only improve your quality of life, but it will also protect your oral and overall health. Don't ignore this symptom. Keeping your mouth hydrated is essential for your well-being. Number 5. Nighttime leg cramps. This pain can be linked to diabetes. Nighttime leg cramps are painful and can disrupt your sleep and affect your quality of life. This symptom, although common, is often linked to problems like lack of exercise, dehydration, or stress. However, in people with diabetes, cramps can be a sign of diabetic neuropathy, a complication that occurs when high blood sugar levels damage the nerves. These cramps tend to come on suddenly and can last from a few seconds to several minutes, leaving behind a feeling of lingering pain or discomfort. Nerve damage from diabetes can also lead to circulatory problems, further aggravating the occurrence of cramps. When blood doesn't circulate properly in the limbs, muscles don't get the oxygen and nutrients they need to function properly, increasing the risk of painful muscle contractions. This vicious cycle can make nights especially difficult for those who suffer from this condition. If nighttime leg cramps have become a regular thing in your life, it's essential to see a doctor to assess the health of your nerves and circulation. Even though this may seem like a minor symptom, it's a sign that your body needs attention. There are treatments and strategies that can help alleviate the pain and prevent future episodes, from dietary changes to specific exercises. Don't ignore this symptom. It could be the key to identifying and managing diabetes complications before they worsen. Number 6. Sleep disturbances. How diabetes affects your sleep. Sleep is a fundamental pillar of health, but for people with diabetes, it can become a constant challenge. Sleep disturbances or difficulty sleeping soundly can be directly related to various symptoms of diabetes that affect the body during the night. From the constant need to urinate to the discomfort caused by cramps or night sweats, these interruptions can turn your nights into a vicious cycle of awakenings and increasing fatigue. Sleep disturbances can also be related to hormonal imbalances caused by diabetes. For example, fluctuations in blood sugar levels can lead to hypoglycemia or hyperglycemia, both of which can disrupt sleep. In addition, the anxiety of managing the condition or worries about overall health can amplify sleep problems, creating a vicious cycle in which lack of sleep negatively affects blood sugar control. Poor quality sleep not only aggravates the symptoms of diabetes, but can also make it more difficult to manage the disease in the long term. Lack of sleep is linked to increased levels of cortisol, a hormone that can increase blood sugar. So, if you find that your nights are characterized by interruptions, it is essential to talk to your doctor. In addition to treating specific symptoms, adopting sleep hygiene measures such as maintaining a regular sleep-wake rhythm and creating a relaxing environment for sleeping can help improve your quality of life. 7th danger: snoring and sleep apnea, a nighttime problem with serious consequences. Snoring might seem like a harmless habit, maybe even a funny family joke, but if it comes with pauses in breathing during sleep, that's called sleep apnea. It can be a sign of a more serious health problem. People with sleep apnea not only suffer from constant sleep interruptions, but they also have a higher risk of developing type 2 diabetes. The link between these two conditions lies in the impact of sleep apnea on metabolism, which promotes insulin resistance and increases blood sugar levels. If you or someone you know snores loudly or has pauses in breathing during sleep, it's important to take this symptom seriously. Sleep apnea can lead to low oxygen levels during the night, which puts a strain on the body and worsens other health issues. Additionally, this condition can lead to extreme daytime fatigue, difficulty concentrating, and an increased risk of heart disease. Treating sleep apnea can make a big difference, not just for your sleep, but also for your ability to manage your diabetes. Whether it's devices like continuous positive airway pressure, CPAP, or lifestyle changes like weight loss or avoiding certain foods before bed, there are solutions that can help you breathe better and improve your overall health. Don't ignore persistent snoring. It could be the key to identifying a bigger problem and protecting your long-term well-being. Heads up, itchy skin. This symptom can say a lot about your health. Do you notice constant itching, especially at night? While it's often blamed on dry skin or outside factors, it can be a sign of underlying health issues, including diabetes. Dry, itchy skin can be a result of poor circulation and high blood sugar, which affects your body's ability to hydrate and maintain healthy skin. Plus, diabetes can increase the risk of skin infections, making the itching even worse. People with diabetes often have a harder time fighting off infections, meaning small cuts or scratches can turn into bigger problems. Persistent itching isn't just annoying, it can also disrupt sleep and impact your quality of life. To find relief from this symptom, it's key to stay hydrated both inside and out. Using moisturizers made for dry skin and managing your blood sugar levels can help reduce itching. If itching persists, it's essential to see a doctor as it could be a sign that your diabetes isn't well managed. Don't ignore a seemingly harmless symptom like itchy skin. Your skin might be warning you about a bigger issue. Number 9. Skin darkening, an early warning sign of insulin resistance. One of the most evident signs of diabetes or insulin resistance is the darkening of certain areas of the skin, known as acanthosis nigricans. This symptom manifests as dark, thick, velvety patches, which appear especially in skin folds like the neck, armpits, groin, or behind the knees. Although this symptom doesn't appear exclusively at night, it can be more evident at the end of the day or after undressing. Skin darkening is a clear sign that your body is having trouble processing insulin effectively. It can be an early warning sign for prediabetes or type 2 diabetes, and is therefore an important signal to recognize the disease before it becomes more serious. Often those affected don't feel pain or discomfort, which is why this symptom is easily ignored. However, its appearance should be taken seriously, as it can be the key to early diagnosis and preventive measures. If you notice changes like this on your skin, it's important to consult a doctor. The doctor can perform tests to check your blood sugar levels and determine if you are at risk of developing diabetes. Additionally, a healthy weight, regular exercise, and a balanced diet can help reduce insulin resistance and improve the appearance of your skin. This symptom may seem superficial, but its meaning is deep. Listen to your body. Number 10. Tingling in your hands and feet. This is a sign of nerve damage. Tingling, burning, or numbness in your hands and feet is a symptom known as diabetic neuropathy, a common complication of diabetes that affects your nerves. This feeling, which often gets worse at night, may be a sign that high blood sugar is damaging the nerve fibers in your body. While it may seem like a small annoyance at first, persistent tingling can lead to chronic pain or even complete loss of feeling in the affected areas. Diabetic neuropathy isn't just uncomfortable, it can also increase your risk of serious injuries. For example, if you lose feeling in your feet, you might not notice cuts, blisters, or infections, which can lead to serious complications if not treated promptly. This symptom is a clear sign that your blood sugar level has been out of control for a long time and requires immediate medical attention. If you experience tingling or numbness in your hands or feet, consult a doctor as soon as possible. There are treatments that can help relieve symptoms and prevent further nerve damage, from medication to lifestyle changes. This symptom may seem harmless, but its impact on your quality of life can be significant. Don't ignore it. Addressing this issue promptly is crucial to protecting your long-term health. Your body is constantly talking to you, even in your sleep, telling you what it needs. These 10 nighttime signs could be the key to recognizing diabetes early and avoiding serious problems. If you see yourself in any of these signs, take them seriously. Talk to your doctor and take action before it's too late. Remember, prevention is better than cure. Thanks for watching. Subscribe to our channel and share this video to help more people take care of their health. See you next time.